Hi, this is Dr. John Brady, and this is an evening with an IMP. It's actually a rebroadcast of the original lecture that was given in conjunction with the 2011 Virginia Academy of Family Physicians summer meeting. A few people asked me to try and put it on the web. The original lecture itself, the audio came through okay, but the video didn't, so I thought I would try and do it this way and break it up into segments that could be used on YouTube. The content of this program is supported by Ideal Medical Practices, which is a nonprofit organization. I'll talk more about them later. Although the program was originally run in conjunction with the VAFP meeting, it was entirely independent of the VAFP, and therefore the VAFP is in no way liable for the content of this presentation. And the VAFP was nice enough to donate a room and a projector, and I was actually very appreciative of that. It's just some personal disclosures. I am on the board of the Virginia Academy of Family Physicians. I'm also on the board of Ideal Medical Practices, and I serve as the secretary of Ideal Medical Practices and as one of its founding members. I am the sole owner and operator of the Village Doctor, which is a solo independent practice, family practice, located in the Hilton Village section of Newport News. I've been in solo practice now for about 8.5 years. I'm not getting paid by anybody to give my thoughts that are going to be presented through these lectures, and therefore it's totally my fault if you become overly bored. I'm going to divide the lecture actually into two main lectures. One is defining a problem, and the second is offering a solution. The length of the lectures are not equal. Defining a problem, I believe, it takes a little bit longer, but we'll work our way through them. The objectives, you can read them here, but basically defining a problem is to discuss how the current medical environment is toxic and to understand what effective primary care means, and discuss ways in which the current attempts to improve quality, particularly in primary care, fall short. The second lecture, offering a solution, is to be familiar with the program How's Your Health, understand what breathing room is and why it's important, and discuss about the IMP movement, and of course then be able, or at least have some references that you can use to improve quality in your own practice. Throughout the lecture I'll be doing separating things out into what I consider myths and truths. This is a myth. I'm a narcissistic megalomaniac who's looking to stoke his own ego. The reality is I'm just trying to start a conversation which I think is long overdue. So let's go into defining a problem. And I put underneath there, these are dark times, and a quote from, I believe it was The Goblet of Fire, the movie Goblet of Fire, when Dumbledore talks to Harry Potter and says, "Soon we must face a decision between what is right and what is easy." What I like about that quote is the easy path is, of course, to continue to maintain the status quo and not do anything about it. The difficult path is, which I believe in this case is the right path, is to identify what's going on, what's wrong with it, and then try and offer solutions as to how to improve it. So myth number one, the U.S. medical system is the best in the world. The reality is the U.S. medical system is toxic to patients and physicians. Let's look at the patients part of that first. In 2000, the World Health Organization ranked the U.S. healthcare system 37th in the world. This, of course, was made famous in the movie Sicko by Michael Moore. Interestingly, the World Health Organization no longer ranks healthcare systems based on the data that they did before. Apparently, some first world nation complained vigorously when the original rankings came out. But we have some other data. This is Starfield's data from 2000. This is a while ago, but it's just a landmark article where she said, or she showed, out of 13 industrialized nations, we were 13th for low birth weight, 13th for neonatal mortality, and you can go down the list. Basically, everything was bad except for life expectancy at age 80. Apparently, once or if we can make it to age 80, our patients tend to do quite well. Also in the same article, estimated unnecessary deaths annually If you total it all up, it comes to 225,000 deaths, which makes doctors, actually, in the medical system in this country, the third leading cause of death in the United States, which is a shocking and horrifying number. What about just outpatient stuff? Well, again, same article. You can see outpatient errors lead to 116 million extra visits, 77 million extra prescriptions, and even back in 2000, it was $77 billion in cost, a huge cost that we're bearing because of outpatient errors. In fact, in 2001, looking at this data, the Institute of Medicine came out with its book, Crossing the Quality Chasm, where it said these two really kind of, I think, interesting quotes. The first one, in its current form, American healthcare is incapable of providing the public with the quality healthcare it expects and deserves. I mean, the key word there is incapable. I mean, it can't do it. The way the system is set up now is just not working, and it's not going to work. The second part of it, though, is we are confident that higher levels of quality cannot be achieved by further stressing the current systems of care. Trying harder will not work. Only changing care systems will. So it's not a matter of, doctors aren't doing enough work and we don't care anymore. It's really just a matter of the systems of care are inadequate. They're not working like they should, and that's causing all kinds of problems. But that was in 2001. So what about now? How are things looking now? Well, if you go to the World Health Organization, the last data that we have is life expectancy data in 2009. It's 2009 data. You can see there that life expectancy in 2009 was 79 years of age, which puts us around 34th. Infant mortality was 8 per 1,000, which puts us about 39th. And healthcare expenditure per capita was $7,410, which is quite expensive, far more expensive than, say, United Kingdom and Canada. Interestingly, just looking down at it a little bit, you'll see that the United Kingdom government pays less per person than our government pays per person for healthcare, and the difference is they cover everybody, and we obviously cover about 50%. Cost issue, the U.S. spends more than any other country. We know that Medicare Part A is going to go bankrupt by 2019 is the estimate. 48 million Americans don't have health insurance, which can lead to estimated 48,000 deaths per year. And an estimated cost of family for health insurance in 2025, it's been estimated to be as much as $80,000 per year, which incidentally is what a family of 4 is going to make in the year 2025. So we're definitely on an unsustainable path. I mean, there's just no question about that. Barbara Starfield, we were lucky enough to have a call with Barbara Starfield in June 1st, I believe, 2011, which was unfortunately just a week before she died. But she said on the call some really interesting stuff, and this is one of the quotes that I wrote down. It's not the disease which is expensive, it's what we do with the disease that's expensive. And that's something that we have to keep in mind as we move forward. I'm going to stop right here on the first lecture, and then we'll begin the second lecture in a second.